Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we will be in the book that is called The Specialty Practice of Rehabilitation Nursing, a Core Curriculum, the 8th edition. We will be on page number 175. So this week we're looking at sexual development. So on page 175, under the header of normal physiology of sexual response, it begins by saying the male sexual response requires intact innervation and intact vasculature to the penis. It says the penis is innervated by the sympathetic, which is T10 to L2, and parasympathetic, which is S2 to S4, and somatic or pudendal nerve fiber. So what does all of that mean? Erections are occurring through two different pathways, either the parasympathetic as well as the sympathetic system. So erections begin through reflexogenic. So reflexogenic is constant tactile stimulation. So that could be foreplay, that could be masturbation. Those are touching. So with the touching, the tactile stimulation, it's required for one to have an intact S2 to S4 nerve root. So those fibers are taking that stimulation up the track. And for psychogenic, which is thoracolumbar T10 to L2 pathways to the sex organ, those are activated through the mind, through thinking. So as someone remembers a memory or someone has a fantasy, it's the thinking of it will cause an arousal or an erection for the male. Now, the female response is controlled through sensory pathways from the clitoris and vagina via the pudendal nerves. Pelvic nerves innervate these structures via the hypogastric and uterine plexus, and sexual arousal is triggered by the parasympathetic activity through intact innervation of the S2 and S4 nerve. The uterine smooth muscle is innervated by the sympathetic thoracolumbar T10 to L2 pathways. And fertility is generally not affected by physical injury. It is controlled by the endocrine regulation of the ovulatory cycle. So women who, for example, have sustained a spinal cord injury are still at risk for sexually transmitted diseases. So women should ensure that they are either abstaining from sex or using some sort of barrier method to prevent sexually transmitted diseases, as well as men. Men will also, if they, for example, sustain a spinal cord injury, be at risk for infertility issues, where women who sustain a spinal cord injury, if they're in their childbearing years, can still get pregnant. So they would want to speak to their OBGYN medical provider, and men would go and see their urologist, and they will share and they will have an opportunity to discuss their concerns or questions related to their level of injury, spinal cord injury. And I also want to let you know that the National Infertility Association and the Male Fertility Research Program of the Miami Project to Cure Paralysis can provide resources for couples seeking fertility options. Nurses can also complete what we call the Implicit Sexuality Assessment. It stands for PLISSIT. That is the acronym for the assessment model. And the P stands for permission, and permission to give the client permission to discuss issues related to sexuality. That is the P. The L and the I stand for limited information, and this provides specific information related to sexual problems. The S and S, specific suggestions, provide specific suggestions after clearly identifying the problem. And then lastly, the I and the T, which stand for intensive therapy, provide referrals to appropriate professional resources. And that is on page 176. I also just want to let you know that, remember that use of open-ended questions will always help to elicit more information from the client or the patient. Remember, disabled patients and those who belong to the LGBTQIA plus community face barriers to accessing healthcare services. It is important to assess sexual orientation and gender identity to ensure high quality healthcare, and be sure to address patients by their preferred pronouns. On page number 176, it talks about many different types of medical conditions that can affect sexual health. And diabetes mellitus is one, cancer, unstable angina, COPD, which is chronic obstructive pulmonary disease, substance abuse, mental illness, depression, brain injury, stroke, spinal cord injury, multiple sclerosis, Parkinson's disease, arthritis, and neuropathy. And there are some medications as well that can affect sexual function. So we see antihypertensives, antipsychotics, antidepressants, anti-anxieties, diuretics, oncological agents, and recreational drugs can all affect sexual function. So on page 177, it now says promoting sexual function for older adults can help these clients maintain meaningful sexual relationships despite the health problems and physical limitations associated with aging. So it's important for us as healthcare providers to ensure that we encourage patients to ensure that they have comfortable positions to enjoy sexual intimacy. They can also plan their sexual activities for the morning and take any necessary pain medication beforehand. They can also incorporate massage, hot baths, cold packs, or an electrical massager to relax painful muscles. And lastly, altering positions to accommodate medical devices or painful positions is important. So sharing the knowledge we have can help to encourage and promote or foster sexual health with good practices in place. This week in review, we had an opportunity to discuss sexual development. We looked at the male response as well as the female response. We also talked about the Plisset model and how we can use the Plisset model as a way of performing or a way to perform nursing assessment. Lastly, we looked at how we can promote healthy sexual relationships in our geriatric community. I really want to thank you for coming along on this journey. I'm asking that you will continue to like, comment, and subscribe. Wishing you all the best. Take care. Bye-bye.